Welcome to Evergreen Health, your daily path to a stronger life. Today, we're diving into a crucial topic: the hidden dangers of combining cloves with certain foods and medications. You might be surprised to learn just how risky these fragrant little buds can be. A published case report illustrates this perfectly. A heart attack survivor, stable and thriving on a doctor-prescribed blood thinner, found their health in jeopardy. All it took was a festive holiday season, filled with clove-heavy recipes. Within a mere 2 weeks, the patient's blood became dangerously overthinned. A simple kitchen nick wouldn't stop bleeding. Emergency room tests confirmed their clotting values had plummeted to life-threatening levels. The unsuspecting trigger? Routine dishes, spiced with cloves, which effectively turned a life-saving medication into a potentially lethal mix. Before we fully unpack these hazards, if safeguarding your health is a priority, we invite you to join our growing community. Hit that like button and subscribe. We're dedicated to sharing critical insights that could genuinely keep you safe. And please, tell us your country in the comments below. We love seeing our global health family expand. Your safer health journey truly begins here. Millions worldwide sip chai, bake delightful desserts, or even take clove supplements daily, completely unaware that they might be gambling with their medications. Those tiny buds are powerhouse-packed, boasting antioxidant levels that outpace even blueberries, and anti-inflammatory activity often reported as stronger than turmeric. Research published in BMC Complementary Medicine and Therapies has even shown that cloves can drop blood sugar by an impressive 27%, and in some lab tests, they've outperformed pharmaceuticals against infections. But here's the unsettling truth. The very same bioactive compounds that make cloves so therapeutic can also supercharge drug and food interactions, turning a benefit into a risk. The main actor in this drama is eugenol, which can constitute up to 90% of clove oil. Eugenol gives cloves their signature aroma and many of their benefits, but it also disrupts the body's intricate drug processing machinery. Lab data indicates that eugenol inhibits crucial liver enzymes responsible for metabolizing over 75% of prescription medications. That seemingly innocent, everyday spice habit could be silently transforming critical drugs into harmful toxins within your system. Unlike pharmaceuticals, spices carry no interaction labels, creating perfect conditions for dangerous surprises. Today, we're meticulously breaking down 7 combinations that could land you in the emergency room. These aren't theoretical what-ifs. They are real, documented crises unfolding right now. Whether you're managing diabetes, heart disease, or simply trying to boost your iron levels, the next section could very well be life-saving. All right, let's start the countdown of 7 foods and medications you should never pair with cloves. Interaction 1. Blood-thinning medications. Researchers at Massachusetts General Hospital reported a hazardous interaction between cloves and anticoagulants. A post-heart attack patient had maintained stable clotting control on warfarin until holiday meals, heavy with clove-spiced dishes, derailed everything. Within 2 weeks, their INR surged from a safe 2.5 to a life-threatening 7.8, and a minor kitchen cut wouldn't stop bleeding. The common thread was clove use. Cloves are incredibly rich in eugenol, which possesses strong antiplatelet activity. Work published in Prostaglandins, Leukotrieninins, and Essential Fatty Acids demonstrates that eugenol and acetyl-eugenol suppress platelet aggregation through multiple mechanisms, blocking thromboxane formation while elevating factors that oppose clotting. When cloves are combined with anticoagulants like warfarin or antiplatelet agents such as clopidogrel or aspirin, the result is a perilous double block on hemostasis. Clinical data indicates this pairing can raise bleeding risk by a staggering 300 to 400% compared with medication alone. Even culinary amounts of clove have been shown to lengthen bleeding time in patients on blood thinners. The effects also build and linger. Eugenol's half-life in the bloodstream is roughly 14 to 18 hours. So cloves at dinner can still amplify the next morning's medication dose, creating stacking effects over days to weeks. Regulatory reviews from the European Medicines Agency have described serious hemorrhagic events when spices are used alongside anticoagulant therapy, including gastrointestinal bleeds, intracranial hemorrhage, and uncontrolled surgical bleeding. The American Journal of Health System Pharmacy lists cloves among botanicals most likely to potentiate warfarin's effect. Unfortunately, clinicians may miss this interaction because patients rarely mention cooking habits, and the common natural equals safe assumption creates dangerous blind spots in medication management. If you take anticoagulants, keep clove use to tiny flavoring pinches only. Avoid clove supplements, concentrated teas, and essential oils entirely. And always tell your healthcare team about everything you consume, including everyday spices, so they can manage your therapy safely. Interaction 2. Liver metabolized medications. A puzzling case at Johns Hopkins reshaped how clinicians think about herb-drug interactions. A patient on cholesterol and anxiety prescriptions began showing unpredictable shifts in drug effectiveness. After starting a daily clove extract, lab work revealed medication levels that simply didn't match the prescribed doses, until the team uncovered their routine use of concentrated clove supplements. The mechanism traces back to the liver's cytochrome P450 system, the sophisticated enzyme network that handles the metabolism of more than 3/4 of all prescription drugs. Cutting-edge research in Saudi pharmaceutical sciences shows that eugenol, a primary clove constituent, can markedly inhibit key P450 enzymes, including CYP2C9, CYP2D6, and CYP3A4. When these vital pathways are suppressed, medicines that normally get broken down and cleared can accumulate, driving blood concentrations higher than intended, even when patients take exactly the right dose. In vitro findings indicate eugenol can reduce enzyme activity by 40 to 67%, depending on concentration, levels of inhibition that are clinically meaningful for both efficacy and safety. Drugs most at risk include many everyday prescriptions, statins for cholesterol, several antidepressants, common antihypertensives, and anxiolytics. For example, taking atorvastatin alongside regular clove supplements can significantly raise statin exposure, heightening the risk of severe muscle injury and liver complications. Pairing cloves with an SSRI, such as sertraline, can push levels towards toxicity. This interaction is especially hazardous because it's so unpredictable. The degree of effect varies with individual genetics, enzyme variants, the amount and form of cloves consumed, and the specific drugs involved. Some people show dramatic level changes with small clove intakes, while others appear to tolerate more without obvious issues, making it impossible to forecast who will be affected or how severely. This isn't limited to capsules. Clove-heavy foods and concentrated teas can also slow drug metabolism. If you take prescriptions, particularly those with narrow therapeutic windows, avoid clove supplements and limit concentrated clove preparations. Discuss all spice and herbal use with your healthcare team so dosing and monitoring can be adjusted safely. Interaction 3. Diabetes medications. A real-world case dramatically highlights this danger. A person with well-managed type 2 diabetes on metformin plus insulin began drinking clove tea twice a day. They subsequently suffered repeated bouts of severe hypoglycemia, marked by confusion, trembling, and 2 emergency room visits for urgent treatment. What seemed like a healthy addition created the perfect setup for dangerously low blood glucose. Cloves' glucose-lowering effects are well documented. A landmark study in BMC Complementary Medicine and Therapies showed polyphenol-rich clove extract cut post-meal blood sugar by 21.5% in healthy adults and an impressive 27.2% in pre-diabetics. The mechanisms are multifaceted: slower intestinal carbohydrate absorption, marked suppression of hepatic glucose output, and a strong uptick in muscular glucose uptake. The trouble begins when those potent actions stack on top of diabetes drugs designed to do the very same thing. A concentrated clove infusion alongside prescribed therapy effectively amounts to multiple anti-hypoglycemic agents at once. Research in the Journal of Ethnopharmacology reports clove extracts can reduce hepatic glucose production by about 40%, the very pathway metformin targets. Layering this dual break can push blood sugar into the danger zone. The Cleveland Clinic specifically cautions that combining eugenol-containing products with insulin can precipitate excessively low glucose, and severe hypoglycemia can be life-threatening. This risk is especially tricky because it is unpredictable. Unlike standardized medications, the potency of clove preparations varies by recipe, concentration, and individual metabolism. Some people experience sharp drops with small amounts. Others tolerate more, making safe dosing impossible to forecast. Clove-induced hypoglycemia can present with confusion, a racing pulse, profuse sweating, and the urgent need for rescue glucagon. For people whose insulin and carbohydrate plans are tightly calibrated, adding a powerful glucose-lowering spice can destabilize control and make usual carb counting unreliable. If you use glucose-lowering medications, restrict cloves to minimal culinary pinches and monitor glucose closely. Avoid supplements and concentrated teas or extracts altogether. Interaction. 4. Alcohol and certain beverages. A clinical review of traditional spice-alcohol pairings uncovered troubling reactions in people drinking mulled wine and clove-spiked cocktails. Reports included intense facial flushing, a rapid heartbeat, and dangerous drops in blood pressure. The common thread is clove's impact on how alcohol is processed in the liver. Eugenol inhibits aldehyde dehydrogenase, ALDH, the key enzyme that clears acetaldehyde, alcohol's toxic intermediate. When ALDH is suppressed, acetaldehyde builds up, triggering alcohol intolerance symptoms such as flushing, tachycardia, nausea, and headache. Research in the Journal of Ethnopharmacology shows eugenol's enzyme inhibition can raise acetaldehyde levels 40 to 60% compared with alcohol alone. Practically, a single glass of clove-spiced mulled wine can provoke effects equivalent to much heavier drinking. Risk escalates in anyone already sensitive to alcohol or taking medications that affect alcohol metabolism. The response is dose-dependent and cumulative. Holiday staples like mulled wine, spiced rum punch, and clove-studded hot toddies combine concentrated alcohol with concentrated cloves, a perfect setup for adverse reactions. Even small servings can trigger symptoms in sensitive individuals. Larger amounts may cause vomiting, chest pain, or dangerous blood pressure swings. There are longer-term concerns, too. Sustained acetaldehyde accumulation drives oxidative stress and inflammation in liver tissue. Regularly pairing alcohol with clove-heavy drinks may accelerate liver injury, especially in people with existing liver disease or those on hepatotoxic medications. Yes, some cultural and traditional remedies mix cloves with alcohol, but these should be approached with extreme caution. If you drink alcohol, avoid clove-spiced alcoholic beverages altogether, and be especially wary of seasonal cocktails that feature cloves. Interaction. 5. Iron-rich foods and iron supplements. An anemia treatment study uncovered a surprising obstacle. Despite iron-rich diets and prescribed supplements, several patients failed to improve. Investigators traced the problem to frequent clove-spice dishes and teas consumed with iron-heavy meals, unknowingly undermining mineral uptake. The mechanism centers on tannins, the compounds that give cloves their astringent bite. Research in current developments in nutrition identifies tannins as some of the most potent inhibitors of non-heme iron absorption, the form found in plant foods and many supplements. These polyphenols bind iron in the gut, creating insoluble complexes the body simply can't absorb. Clinical data show tannin intake can cut iron absorption by 60–90% depending on dose and timing. Drinking clove tea alongside iron-rich foods, think spinach salads, or taking an iron tablet with clove-seasoned dishes, drastically reduces bioavailability. Cloves sit among the highest tannin common spices, making them especially strong blockers. Timing is crucial. Studies indicate iron absorption can remain impaired for up to 2 hours after tannin consumption. That means clove-containing foods or beverages taken before an iron-rich meal can still hinder uptake. This wider window catches many off guard. 30 minutes isn't enough, particularly for those treating iron deficiency anemia. The fallout includes delayed recovery and masked treatment effectiveness. The Canadian Digestive Health Foundation advises spacing tannin-rich items 1 to 2 hours away from iron-dense meals to prevent interference. For vegetarians and vegans who rely on non-heme iron, which is more susceptible than heme iron from meat, the impact is even greater. This isn't limited to pills. Dark leafy greens, legumes, fortified cereals, and dried fruits all lose a meaningful share of usable iron when paired with clove-laden preparations. To maximize absorption, keep cloves out of the 2-hour window surrounding iron-rich foods or supplements. Interaction. 6. High-fiber foods and digestive medications. A digestive health study spotted an odd pattern in patients eating high-fiber diets. Those pairing fiber-rich meals with clove-spice dishes reported more bloating, gas, and irregular stools, the opposite of fiber's usual benefits. Follow-up analysis pointed to a lesser-known interaction within the gut ecosystem. Cloves have strong antimicrobial activity, largely due to eugenol. Work reported in the Journal of Applied Microbiology shows eugenol acts broadly, suppressing harmful microbes but also beneficial species. That's helpful during infections, but it can deplete the very bacteria that ferment fiber into short-chain fatty acids that support colon health. When significant amounts of clove are consumed alongside beans, whole grains, or fibrous vegetables, this antimicrobial effect can blunt normal fermentation. Instead of smooth breakdown, more fiber remains unprocessed in the colon, driving excess gas, distension, and discomfort. A paradox where fiber begins to cause the symptoms it typically prevents. The ripple effects include supplements and therapies aimed at gut support. People taking probiotics or digestive enzymes may notice weaker results when those products are swallowed with clove-heavy foods. Studies indicate clove constituents can inactivate probiotic organisms within about 30 minutes of co-ingestion, undermining their value. Medications used for conditions such as irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, can also be impacted. Drugs that rely on specific microbial populations for activation or absorption may work less effectively if the microbiome is disrupted by cloves' antimicrobial action. Timing becomes the key lever. Research suggests separating high-fiber meals and clove intake by at least 2 to 3 hours to reduce interference. For best digestive outcomes, avoid concentrated clove preparations when eating fiber-dense foods or when taking probiotic supplements. Interaction 7. Calcium-rich foods and dairy products. Digestive health investigators noticed a pattern. People routinely sipping clove-spiced chai lattes and other clove beverages alongside dairy were developing unexpected GI complaints and subtle mineral imbalances. Follow-up work pointed to a complex, less obvious interaction between clove bioactives and calcium handling. Cloves do not block calcium at the gut wall the way they hinder non-heme iron. Yet they can interfere with how the body uses calcium after absorption by altering digestive enzymes and the gut microbiome, both central to mineral metabolism and bone integrity. Evidence in the European Journal of Clinical Nutrition indicates that polyphenols present at higher clove concentrations can bind calcium and other minerals in the intestinal tract. This binding does not stop absorption outright, but it can change the rate and efficiency of uptake. When clove-rich drinks or dishes are taken regularly with dairy or calcium supplements, the result over time is less than optimal calcium utilization. The concern is greater for those at risk for osteoporosis or relying on supplements for bone support. Research reported in the Journal of Bone and Mineral Research found that compounds similar to those in cloves can impede calcium incorporation into bone tissue, even when blood calcium appears normal. Standard serum calcium tests may miss these subtle yet meaningful effects of habitual clove intake on skeletal health. Tannin load adds another layer. Cloves are high in tannins, and shifts in the gut bacterial community from frequent tannin exposure can influence calcium metabolism. Beneficial microbes help convert calcium into forms that are easier to use. When tannins repeatedly disturb this balance, downstream impacts on absorption and bone maintenance can follow. Timing matters. Many people consider chai or golden milk to be calcium supportive. Yet pairing high clove amounts with milk may blunt the very benefit they seek. For best results, avoid consuming large quantities of cloves at the same time as dairy products or calcium supplements, and separate clove-heavy preparations from calcium sources to protect absorption and utilization. Safety recommendations. After walking through these 7 high-risk interactions, one crucial conclusion stands out. A tiny clove bud carries far more biochemical force than most people realize. From dangerously prolonged bleeding to severe hypoglycemia, the documented cases showed that natural does not automatically mean safe when foods and drugs intersect. This isn't a call to fear cloves or cut them out completely. Used wisely, they offer real advantages. Their antioxidant capacity outpaces many superfruits, and their anti-inflammatory actions are well described in medical literature. The aim is informed, cautious use that preserves the benefits while steering clear of preventable harm. Here's a practical plan. If you take prescription medicines, especially blood thinners, diabetes therapies, or drugs primarily cleared by the liver, keep cloves to small culinary pinches only. Avoid clove supplements, concentrated teas, and essential oils entirely. Build timing buffers around mineral-dense foods and pills. Separate iron-rich meals and iron tablets from clove intake by at least 2 hours. Apply the same spacing to calcium supplements and dairy to protect calcium handling. Watch your body's signals. Unusual bruising, unexpected blood sugar swings, new digestive issues, or odd medication effects may flag an interaction. Track symptoms and bring them to your clinician, always mentioning your spice habits. For chronic conditions, consistency matters. Your care team sets doses based on predictable metabolism and absorption. Adding concentrated clove preparations introduces a moving target, which can blunt treatment efficacy or trigger side effects. Respect concentration. Many clove extracts and essential oils deliver 50 to 100 times the active compounds found in normal cooking, vastly increasing interaction potential. Share what you've learned. Friends and family managing diabetes, heart disease, or multiple medications are most at risk. Spreading awareness is a simple yet powerful way to protect them. If this video helps safeguard your health or that of someone you love, please type yes in the comments. Your feedback fuels our ongoing work to research and share life-saving information. Thank you for watching Evergreen Health. Subscribe to stay healthy every day.